Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. In this episode, we talk about why plasma therapy has been dropped from India's National Clinical Management Protocol for COVID-19. We also take a quick look at the new guidelines regarding who all should delay getting their COVID-19 vaccination. But first, we talk about a problem that is not being talked about enough right now. COVID-19 so far has claimed over 280,000 lives in the country. And among all these people, there have also been several young parents who have died as well. Sometimes within a gap of a few days and sometimes even together, leaving their infant or adolescent children orphaned. It is a terribly traumatic time for such children who have lost their primary caregivers. What is also concerning right now is that messages have been floating around on social media and WhatsApp that are offering many such children up for adoption. Authorities have raised alarms about such messages and have asked people to approach them instead. In this segment, we talk to Indian Express's chief reporter Mallika Joshi about this problem, what one is supposed to do when faced with such messages, and the reasons that authorities are worried. Mallika, one thing we have seen during this time is that when both parents have been infected by COVID, children have been kind of left on their own. And in several cases, young adult parents have died due to COVID-19, leaving many children orphaned. Could you talk about just what this time has meant for children like these?
So, Shank, we've seen how fast and how rapid the spread of COVID in this particular wave has been. And it's also very wide. We saw in Delhi at one point in time, there were 28,000 cases a day, which is so far the highest in any Indian city so far for a day. So there are a lot of people who were affected, including parents, like a couple with children. Many of them had young children. So let's say children as young as 3 and 4 or 5 and 6 years old. The DCPCR, which is the Delhi Commission for Protection of Child Rights, as well as a few other NGOs that work in this space, have flagged issues of how young parents with children that are not adults yet have either the one parent has died and one is hospitalized, or both parents have succumbed to COVID. So these sort of cases are coming out more and more, and they are more common this time around, essentially because of how widespread the disease was in Delhi and also in a few other parts of the country. So child rights activists and people who work in the space have been flagging these issues for quite some time now. It's been close to a month. And even on social media, we have seen people flagging such cases, asking what can be done, how they can help. DCPCR alone has handled 10 to 15 cases of this nature where both parents have died of COVID, leaving behind young children. So the problem is quite widespread. It's a very tough situation for children who are left in this situation. These are not adults. Some of them are maybe adults. They are 18 years old, but they're still studying. And 18 years old for a person to just then be left alone is still a worry for a lot of people.
And, in light of these incidents, one thing that we have seen on social media and WhatsApp are messages in which people have been offering children up for adoption. And authorities have been raising concerns and alarm about these messages. So what are things that they have been saying about these messages and, just the concerns that there is?
So while a lot of people are very well-meaning and well-intentioned, this is the completely wrong way to go about it. Children can't be offered up for adoption on social media sites. You can't just tell someone that, hey, if you want to adopt a child, there is this person whose child is available and you can come and adopt them. Adoption is a legal process which involves very, very stringent background check to make sure that a family, even if they are well-intentioned and they want to adopt a child, they fulfill the criteria, they fulfill the income criteria, they will be able to take care of the child, their living conditions. A lot of things are taken into account before a child is given up for adoption. And there is a centralized agency called the CARA, which coordinates these, and they, in every state, they coordinate with orphanages or people and a lot of NGOs and child rights organizations for this kind of work. So putting up messages saying that this child has lost both parents and is up for adoption is actually a completely wrong way to go about it. What has to be done in these cases is that authorities like as I said, the Delhi Commission of Protection of Child Rights or Child Helpline 1098. These people can be called and they can then coordinate the adoption process. And that's, again, as I said, not very simple and not very straightforward. The first step in this is to notify an authority. The child is then presented in front of a statutory body, which is a child welfare committee. Each district has its own child welfare committee. And they, first of all, assess the health of the child and the well-being of the child. And they see if the child can be housed with a relative, which is always the first and the best option that they consider. Because moving a child away from a family situation into a home, I was speaking to the head of the Delhi Commission of Protection of Child Rights, and he told me that an average family, a completely average family with average means, is still a much better option than the best childcare home. Because at the end of the day, what a child needs is that level of security, also some familiarity with the people that he or she are around. So these are things that are taken into account very carefully because before anything of this sort is done. So the Child Welfare Committee is the statutory body which should be the first point of contact in such cases. They will assess the situation and then accordingly, preferably home the child, even if it's for some time, with a relative that the child is comfortable with and knows. And if in case that possibility is not there, then and only then will they send the child to a childcare home. From where the next step has to be decided, whether it's adoption or housing the child over there, sending that child to school, or a lot of other processes.
Right, and even if immediate family members and relatives want to adopt children, they should ideally be going through CARA, right? And not just taking in these children on their own.
Yes, again, no, you can't just take a kid on your own. The process, as I said, the assessment by the Child Welfare Committee will happen either way. So even if you want to adopt a child who is related to you, that background check, all of those things will still happen. But adoption by a family member, by a relative, is preferred for the well-being of the child, but only once the conditions are followed.
And we were talking about these messages for adoption on social media and WhatsApp. Is there also a worry amongst authorities that these kind of messages will lead to child trafficking?
Yes, absolutely. That is one of the main worries that these people have, that you can put out a message on social media saying that this child is up for adoption, but then you are not equipped to do that background check to make sure that the child will be safe with the person that you are reaching out to or the person who is reaching out to you. So that is actually a very big worry. Child trafficking is a harsh and sad reality, so it's not something that the authorities can afford to ignore. So that is one of the primary worries, actually, that this could, in some cases, also lead to child trafficking.
And are there any steps that the government has taken to help these children?
So there are helpline numbers, of course. But apart from that, monetary help initially, so the Delhi government, for example, has said that the education of these children who have lost parents the expenses will be borne by the Delhi government. And in families that have lost an earning member, those families will get a monthly pension. And again, as children who have lost both parents, they will also be given a monthly stipend of 2,500 rupees, and their education will be reimbursed. The cost of education will be reimbursed. These are some steps that were announced only a couple of days ago.
And the other thing that we'd be remiss not to mention, of course, is just the kind of mental trauma these children will end up facing, right? Especially adolescents and teenagers who will have to just go through this entire ordeal and will have to actually deal with the loss of both parents.
Yeah, that's one of the, after, just physical sort of well-being of a child, that's the second biggest worry, because this is a trauma that you will have to deal with, and there's no way to shelter you from it. But there are ways to help you deal with that. And when we talk about the child welfare committees and with all these organizations that work for children, what they also do is, once they hear that this has happened to a particular child, for example, one of the first things they have to do is to make sure that the child's physical, which is food and shelter, these needs are fulfilled, plus any medical needs. Because in some cases, while the parents might have passed away, the child is also exposed to COVID. So, their medical tests, admission into hospitals, all of that has to be taken care of. But apart from that, the mental aspect of this, that is also something that these organizations do and will have to undertake, because many of them might need counseling, they might need help through this time in their lives. So while a lot of them already have their mental health wings, some of them also get in touch with child psychologists and therapists who can help children deal with the trauma. But again, as I said, the best thing for children in this situation is to be homed with people that they know, that they are comfortable with. Because for a child to suddenly be plucked out of a situation and put into a childcare home is in itself another trauma. So it is an added burden for these children to be able to adjust to a completely new situation just suddenly. So these services are available with childcare homes as well. But apart from that, even some of these organizations that we spoke about, they also look into the aspect of mental health.
And next, we talk about convalescent plasma therapy, which is popularly called plasma therapy. On Monday, India removed this therapy from its National Clinical Management Protocol for COVID 19. This was declared by AIMS and ICMR COVID 19 National Task Force and the Health Ministry. And it indicates that convalescent plasma offers no therapeutic benefits in patients admitted to hospitals with COVID 19. In this segment, we talk to Kaunain Sheriff, who reports on health for the Indian Express, about what led to this decision and what trials have shown regarding this treatment. Kaunain, could you first talk about exactly how plasma therapy works?
So before I go into how the plasma therapy works, I'll tell you what plasma is. Plasma is the liquid portion of the blood that remains after you remove the red blood cells, the white blood cells, the platelets, and other cellular components. So when we talk about plasma, we're talking about convalescent plasma. That is the plasma that is extracted from the patients who have recovered from COVID-19. This could be patients who are asymptomatic as well as patients who have undergone treatment. So the rationale of using plasma or convalescent plasma is the fact that people who have recovered have a certain volume of antibodies. Antibodies are basically proteins which fight against or provide immunity in fighting against the infection. So this was one of the first investigational therapies that was introduced in COVID-19, not just in India but across the world. In fact, the US was one of the first countries to use the convalescent plasma, and the US FDA had actually given an emergency use authorization. So, but this therapy is not a new therapy at all. In many viral infections, convalescent plasma has been used for almost decades. But however, in terms of SARS-CoV-2 infection, it has not found to be efficacious. There have been many trials. In fact, India had conducted one of the biggest trials in November last year, which we call as the Placid trial, which had shown no effectiveness in terms of hospitalization. Then we had studies from Netherlands, we had studies from China, and recently we have one of the biggest study from the recovery trial in the UK, which has shown that the plasma therapy as investigational therapy is not effective against SARS-CoV-2. So what it means that people who are hospitalized, for them this therapy is there is no outcome in terms of reduction in either hospitalization or the mortality.
But despite it not reducing hospitalization or reducing mortality, this method has been pretty popular during the pandemic. We have seen so many people looking for plasma donors for COVID patients they know. In emergency situations, people have been seen scrambling, trying to find plasma donors. But now, of course, India has dropped it from its national clinical management protocol for COVID 19. So, what actually led to the government taking this decision?
So to begin with, when we started the clinical management protocol, we had many investigational therapies, which we call as repurposed drugs. Initially, in the first few weeks, we started using lopinavir and ritonavir, which are popular HIV drugs. Then we removed them from the COVID protocol. Then we started using plasma therapy because plasma therapy globally had become acceptable. So we started using plasma therapy. So in fact, we couldn't use plasma therapy in the first few months because we didn't have that many recovered patients. But it became really popular when our surge was higher somewhere in the month of September and October. And national capital, which is Delhi, started even establishing plasma banks. So that's why it had become really popular because the availability, the other drugs that we were using were repurposed drugs of an other viral infection. However, plasma therapy were antibodies generated against the infection itself in the recovered patient. So that is why it had become popular, and we had also seen several states at local level pushing for it. But in the month of October, then we saw a huge trial result that came out, which is the Placid trial, the findings which were then published in British Medical Journal, where we had found that it was not associated with any reduction in progression from severe illness or in terms of mortality. In fact, in November last year, ICMR had issued a evidence-based advisory to address the inappropriate use of convalescent plasma. And after that, in our own clinical management protocol, we said that convalescent plasma can be used, but only when it meets two specific criteria. First is that it can be used only in early or moderate disease, preferably within 7 days of symptoms, and it should not be used after 7 days of onset of symptoms. And even if you're using, if it meets the first criteria, second criteria should be that there should be high volume of the antibodies in that plasma. So it was clearly mentioned in as early as November last year itself that plasma therapy works or has little benefits only in early moderate disease, and it has no role at all in severe disease. But at hospital levels, because it is an investigational therapy, doctors have the discretion to use it. All of the drugs which are using for severe and moderate disease are repurposed drugs or investigational therapies. So the discretion lies with the doctors, and that is why we are seeing certain hospitals still recommending it for severe infection. In fact, when ICMR's own the Placid trial in October last year itself had shown that there was absolutely no reduction in progression to severe disease. So it is a call that has been taken by the treating doctor.
So that means despite it being dropped in the national guidelines, doctors around the country can still prescribe it to patients suffering from COVID-19?
Yeah, of course they can. We know so many of the drugs that are not part of the National Clinical Management Protocol that are being used by the treating doctors. There are versions of the tocilizumab, which is not the exact version of tocilizumab, which is being used. So really, these repurposed drugs, or what we call as investigational therapies, are being used on pure discretion of the physician, and the similar thing will be applicable to plasma. And if the physician advises or recommends the patient or the patient attendants to get plasma, then they can still continue to use. There is no bar, but as a part of India's clinical management protocol, now we have finally followed what the global practices are saying, that convalescent plasma offers no therapeutic benefits in patients who are hospitalized. So, yeah, on one side, yes, it is not recommended, but the doctors can still continue to use it.
And Conan, the other thing that has happened now is that the health ministry has said that if you have gone through plasma therapy, then you are supposed to take the COVID-19 vaccine only after 3 months. Do we know why that has been done?
Well, similar recommendations have been made by other countries. Like CDC had made a similar recommendation with respect to both people who have undergone monoclonal antibody treatment as well as plasma treatment. So what CDC had suggested is that the reason behind the deferment is that reinfections with COVID-19 is very uncommon in 90 days after the initial infection. But it says that after the treatment, a person who has undergone treatment, there could be some interference of this monoclonal antibodies or plasma therapy in the vaccine induced immune response. So that is the reason why they have suggested that there should be some deferment to avoid any sort of interference of these two treatments, specifically with vaccine induced immune response. Because you need to realize that when you take the first dose or the second dose of vaccine, there are many components of vaccine induced immune response, especially the T cell immune response, so that there is a more robust sort of immune response. They have said that you should avoid deferring the vaccination for people who have undergone these two treatments. So that's the scientific rationale why to differ. So that's the reason why, to avoid interference of monoclonal antibody treatment, specifically with vaccine-induced immune response, the health ministry, like how the CDC has said, has told to defer the vaccination in people who have undergone these two treatments.
And are there other examples of things that remain in India's clinical management protocol that haven't shown any effectiveness in trials?
So yes, there are two other repurposed drugs which are recommended for off-label use in the clinical management protocol, are not considered to be effective against COVID-19. In fact, on April 24th, the ICMR and AIIMS made changes to the clinical management protocol in terms of when these drugs can be used to make it effective. Clearly indicating that they can't be just used otherwise in any patient who is hospitalized. With respect to Remdesivir, which is an antiviral drug, they said it can be used in moderate to severe disease within 10 days of symptom onset. Otherwise, there is no effectiveness in the drug. In terms of Tocilizumab, they have recommended the off-label use for severe cases, preferably 24 to 48 hours on the onset of ICU admission. So clearly indicating that it can be used only in terms for ICU patients. So it is very important because similar studies again have been published globally. We have studies from China, one of the first studies which was published in NECM that did not show any benefit with regards to remdesivir. Later, the only study that showed positive signs was related to hospital stay, that it only reduced hospital number of days of hospital stay and it had no mortality benefit. And the recovery trial, which is sponsored by WHO, also did not show any benefit. So clearly, there is no, it's not a magical bullet, and there's no clinical evidence so far to show that remdesivir decreases mortality. The clinical research head, Randeep Guleria, who actually heads this team which formulates this protocol, has said that it is only useful in those patients who are hospitalized, whose oxygen saturation has dropped, and whose CT scan usually shows some sort of infiltrate on the 5th to 7th day. So when it has to be used is very, very important. So he says that it is not useful if you give it too late because then you will have more cytokine storm rather than having the infection. Same with Tocilizumab, Guleria says that it can be used in less than 2% of COVID-19 patients. And he says that it can be used only if there is a cytokine storm in the patient. And basically what he's trying to say that it can be used in patients who are in ICU and have very high inflammatory markers. So the only drug in the clinical management protocol which have sort of shown little benefits, the steroids. But again, with steroids, we have to be very, very careful that steroids cannot be used at the beginning, and it has to be used only if there is a drop in saturation that is below 95, and below 94 or 95, it has to be used after advice from a treating doctor. So even steroids should not be used indiscriminately if you are tested positive and if your oxygen saturation is normal. So steroids have benefits. The recovery trials have in fact shown that it shows benefits, but it is useful in the later part of the disease when the oxygen saturation falls and patient has moderate disease. So therefore, steroids cannot be given throughout. In fact, we are seeing that some of those fungal infections that are occurring, a drop in oxygen that we are seeing is because of the indiscriminate use of steroids. So the clinical management protocols are very clear that most of these drugs can be used only at a specific time period to show some benefits because all of them are repurposed drugs.
And in the end, we talk about new guidelines issued by the Health Ministry about vaccinations. Yesterday, the ministry said that 4 specific categories of individuals should delay getting their COVID-19 vaccinations. The first category includes all those who have tested positive for COVID-19. The guidelines say that if that is the case, then you should get the vaccine 3 months after recovery. And this even applies to those who have got their first shot. If, for example, you have received your first dose but have tested positive after it, then you should get your second dose 3 months after recovery. Now, these were the first 2 categories. The third category includes individuals with any other serious general illness that requires hospitalization or ICU care. For them, it is recommended that they wait 4 to 8 weeks before getting the COVID-19 vaccine. The guidelines do, however, mention that those who have severe comorbidities, including cancer, should not defer vaccination, and that only those who have been hospitalized or have undergone treatment for the comorbidities in critical care should delay vaccination. And the last category, as we discussed before on the podcast, is about people who have been given anti-SARS-2 monoclonal antibodies or convalescent plasma. According to the guidelines, they should delay vaccination by 3 months from the date of discharge from the hospital. You were listening to 3 Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargav, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.